Let's see how this goes. Oh, I look terrible. Whatever, we'll make the best out of it. All right. Uh, Video diary. Monday, June 3rd? Sure. June 2nd, June 3rd, I don't know. 2024. Let's go. I'll recap since Thursday because I ran out of storage on the iPhone. Yeah, and I made that short little video. So, a lot to go over. And I'll try to be quick about it, but I still don't feel good from chemo this week. And we're making the best out of it. So, here goes. Thursday, chemo, doctor visits, confirmed the thing in the leg is actually still a tumor. Still got to take care of it. We talked options. Surgery not an option right now. Inconclusive if the chemo I'm currently on is helping it shrink or not. The doctor does think it's still a UPS, the same type as I have had and continue to have, a undifferentiated pleomorphic sarcoma. Go ahead and Google that. Don't look at the survivorship rates. It's something I like to not think about. So he thinks it's still the same thing. And then radiation. We talked about radiation. So that's kind of where we landed. So I did chemo on Thursday, where you get the 2-drug treatment. And it felt good. I mean, this chemo is not as bad as the AIM. I felt good during and after chemo. Friday I felt really good. Now with this drug, on Friday, you go get this drug called, you get a shot called Neulasta, like just in your belly fat or whatever, after the day after the treatment. And it's supposed to help increase your white blood count. But, man, it makes you feel like garbage. And I think it's why I feel like garbage all weekend. I would get this with the AIM treatment as well, and it gives you bone pain, apparently. So if you take over-the-counter Claritin and Prilosec, actually, it's supposed to help with bone pain. It's a side effect of these common over-the-counter drugs, and I take it, and I guess it helps. I mean, I still have it. I've never had arthritis before, but this is what I would imagine moderate to severe arthritis feeling like. And it jumps around the body. Sometimes it's in my knee, sometimes it's like in the shaft of the bone, like right here. Sometimes it's in the wrist. I can feel it sometimes in the jaw, in the teeth, ribs. You can feel it. It just kind of moves around. And then in addition to that, it was just like full body pains. Kind of the closest thing I can relate to is like having the flu. Like your whole body aches. I tell everybody in text messages and in person, like, I just feel like Mike Tyson's been wailing on me when I wake up in the morning. My whole body just hurts. And you don't want to do anything. You're lethargic. Justifiably so. So like Thursday and Friday I was good. Saturday, I was up at like 3:30, back to bed at 5, up at 8, stayed up for a couple hours and basically sleeping most of the day. Probably Saturday and Sunday I slept 16 plus hours a day. Not all in one chunk, obviously, but a lot of sleeping, not wanting to do a whole lot when I'm up. Trying to do some stuff, but not really doing successful. Today, those effects are finally starting to subside. It's about 4 in the afternoon now, and I'm finally kind of coming around. Lots of caffeine helps. And the reason I'm waiting so late to do this video is because my damn neighbor's been on like a 3-hour cut in the lawn and all kinds of crap, Lollapalooza, and it's loud as hell. I'm just like, dude, it's the middle of the day on a Monday. You gotta cut that crap out. Just just stop. Such a first world problem I have. It's my neighbors and their loud ass lawn equipment. Uh, when you're home all the time and you hear lawn equipment every day, it kind of really gets on your nerves. Yeah, I know. There's starving people in Africa, and I'm bitching about lawn equipment. Anyways, all right, let's circle back. So Friday, I had a doctor's appointment with my radiation oncologist, Dr. Williams, and he's a really super cool guy. Really like him. He's young, about my age. He knows my lawyer. He's an Ole Miss guy, so I can't get rid of these Ole Miss guys. My lawyer's an Ole Miss guy. He's an Ole Miss guy. I'm just doomed to be an LSU fan, surrounded by these Ole Miss people, but that's all right. um, so he talked. Me and him talked. We had a lengthy talk. We're gonna hit the leg tumor with 5 days of intense radiation, and we'll start this Friday coming up. And he also made me realize that the shortness of breath I've been having was quite possibly in part due to pneumonitis, which is inflammation in the lungs due to radiation therapy. You may or may not know, I had radiation therapy several times earlier this year in January and February on the diaphragm and other spots in my lungs because things were popping up. So I had pretty intensive radiation therapy before I went to MD Anderson for a visit in January and February. And it takes a couple months for the inflammation to onset, and I'm kind of right in that window, he said. So there's a good possibility that my shortness of breath has at least partially due to pneumonitis, which is the inflammation in the lungs. And my breathing actually has been getting better. The past couple of days I've been taking ibuprofen, which has anti-inflammatory properties, and it seems to be helping quite a bit. So I wish I would have spoken with him sooner, and I think I'd have been a lot better off. So fingers crossed, we're gonna maybe crest that problem. Otherwise, Dad came in town this weekend. Yeah, I think he came in Saturday and did a lot of great things for me. Thank you, Dad. Much appreciated. We got a hose reel installed on the side of the house, so hopefully I can start like washing cars again. It's something I really enjoy doing. It's very therapeutic for me, and I just like having a clean car. So if you have a halfway decent car, you owe it to yourself to keep it clean, and don't bring it through a drive-through wash. All it does is scratch your clear coat. Excuse me, hand wash only. So we got that installed. Dad cut grass, changed oil in lawnmower, weeded, basically did all the outside work that I really can't do right now. And what else did we do? So just a little small piddly projects around the house. Nothing's really sticking out right now that I can remember, but you know, he's been helpful. He's always helpful when he comes in, and it's really appreciated because I can't get to do these things. And Josie's been really busy with schoolwork. She's started summer school and calculus, Calc 1, and it's a tough class. I'm trying to help tutor her a little bit through it from what scratchy memory I have of it. And I'm not the best tutor, but I do the best I can. So we're fumbling through asymptotes right now and all that jazz, and I'm having flashbacks to sophomore year in college, although with a lot less beer. I could take the beer right now. Otherwise, Monday, I've literally been laying around all day today. I have not felt good most of the day, and I'm finally starting to feel a little bit better. This week's pretty light. I think I only have the radiation on Friday. Otherwise, I have a pretty light week, so I'm hoping that tomorrow I can start feeling better and take care of some things around the house. I have some things to do here that I'd like to get done, and I'd just like to have a week with minimal doctor's appointments that I feel okay. That would be a nice change of pace for a little bit. So that's what I'm looking forward to. I bought a new microphone, if I can reach it. Need an adapter cable to come in, but it's a little Blue Yeti Nano condenser mic. It'll go here. get Phil his back, and maybe I can get some better audio quality with without having to do so much post-processing in DaVinci Studio, DaVinci Resolve, I mean. If not, it was $40. I've spent $40 worse ways before. Yeah, if I'm feeling good this week, I'll get paint and start painting on this room, and maybe get it looking nice, how it needs to look. Trying to think if there's anything else really. No. Managing finances. I'm finally running out of money in the checking account, so I've got to start selling things and moving money into checking, which gives me anxiety because I'm a big saver, and now I'm in the phase of life where I have to draw down money. And so obviously I want the accounts to go up, the stock market to go up more than what I draw down every month. And of course that's not a given by any means, but let's see if I can manage my anxiety, my money anxiety, by controlling spending and not watching the market every day, looking for up days, because at the end of the day, probably the dollar amount in the account doesn't matter. Something me and Dr. Williams actually talked about on Friday was that you don't want to be the richest guy in the graveyard, or gal in the graveyard. Save your money, but spend it on yourself, spend it on your family, spend it on people you love before you die. It's a lot better than sitting in a bank account when you're dead. So if I could give people that had enough money life advice, I would say enjoy it. You never know when you're going to kick it. All right, I think that's it for now. Love you, Cam.